There is a headache pill in your bathroom right now. It costs you almost nothing. It works in about 20 minutes. And for most of human history, it would have been worth more than gold. Because here's a fact we never stop to think about. For thousands of years, pain simply had no off switch. A toothache lasted until the tooth died. A broken bone hurt for every minute of every week it took to heal. And surgery, when it happened while you were awake. The ancient Egyptians lived in that world, and they hurt constantly. We know because we have their bodies, and the bones tell a story of worn-out spines, shattered limbs, abscessed jaws, and arthritis in people barely 30 years old. But here's what makes Egypt different from every other ancient civilization. They didn't just suffer, they fought back. They wrote the world's first medical textbooks. They mixed remedies that, 3,000 years later, turned out to contain real, working drugs. Some of their prescriptions are, chemically speaking, the direct ancestors of the pills in your bathroom. This is the story of the war on pain, fought 3,000 years before anesthesia, with honey, herbs, willow, copper, magic spells, and a few substances that would absolutely not be legal today. But before we open the medicine cabinet, you need to understand just how much pain we're talking about. Because daily life in ancient Egypt was a machine for generating it. Start with the teeth, because almost everyone's hurt. Egyptian bread was full of grit and sand from the grinding stones, and a lifetime of chewing it sanded human teeth down to flat, exposed stumps. When the soft pulp inside the tooth is exposed, infection follows, and abscesses form, pockets of pressure drilling into the jawbone. We've scanned mummies, pharaohs included, with jaws so riddled with abscesses that some researchers believe the infections may have contributed to their deaths. Imagine the worst toothache of your life. Now imagine it as a permanent condition, with no dentist's needle anywhere on Earth. Then the body. Egypt was built by hand, hauling stone, plowing fields, carrying water, grinding grain on your knees for hours. The skeletons of ordinary Egyptians show compressed spines, torn joints, and severe arthritis at ages we would consider young. The workers who cut the royal tombs breathed stone dust all day. Women who spent years grinding flour have a signature pattern of damage in their knees and toes that archaeologists can spot instantly. Add the accidents, falling masonry, kicks from animals, fractures that healed crooked. Add parasites from the river that caused chronic internal pain. Add childbirth, with no relief whatsoever. That was the baseline of existence. Pain wasn't an event in ancient Egypt. It was the background noise of being alive. So what did you actually do about it? Your first stop was a physician, and this is where Egypt will surprise you. Because Egyptian doctors were not witch doctors waving bones. They were the most respected medical professionals of the ancient world, with training, specializations, and, incredibly, textbooks. We still have those textbooks. The Ebers Papyrus, written around 1550 BC, is a medical encyclopedia over 20 meters long, containing roughly 700 prescriptions and remedies for wounds, burns, stomach pain, headaches, tumors, toothaches. The Edwin Smith Papyrus is even more astonishing, a trauma manual, organized like a modern one, working through 48 injury cases from the head downward, each with an examination, a diagnosis, and a verdict. And the verdicts are brutally honest. Some cases are marked, in effect, an ailment I will treat. Others, an ailment I will fight with. And some simply, an ailment not to be treated. A doctor, 3,500 years ago, trained to recognize what he could and couldn't fix, and to tell you the truth about it. These doctors had a theory of pain, too. They believed the body was a network of channels, like the Nile's irrigation canals, carrying blood, air, and fluids. Pain, they reasoned, came from blockage, something rotten trapped in the channels, poisoning you from inside. Wrong about the anatomy, but notice the logic. It's rational, physical, cause and effect thinking. Pain wasn't random punishment, it was a plumbing problem. And plumbing problems have solutions. So let's open their medicine cabinet, because this is where it gets genuinely incredible. Several things on these shelves actually worked. Shelf 1. Willow. Egyptian prescriptions repeatedly call for the leaves and bark of the willow tree, applied to inflamed wounds and swollen joints, or taken for aches. 3,000 years later, chemists studying willow bark isolated its active ingredient, salicin, and refined it into a little compound called acetylsalicylic acid. You know it as aspirin. When an Egyptian physician wrapped a throbbing joint in willow, he was administering the raw, unrefined ancestor of the most successful painkiller in human history. He had no idea why it worked. It just did, and that was enough to write it down. Shelf 2. Honey. It's everywhere in Egyptian medicine. Smeared on wounds, packed in burns, mixed into almost everything. For centuries, modern doctors smiled at this as primitive superstition. Then we tested it. Honey is genuinely antibacterial. It's so concentrated in sugar that it dehydrates bacteria, and it slowly releases hydrogen peroxide. Hospitals today sell medical-grade honey dressings for stubborn wounds. The Egyptians had a working antiseptic on their shelves when the word bacteria was still 3,000 years away. And by preventing infection, they were preventing the worst pain of all, the slow agony of a wound going bad. Shelf 3, and this is the one that raises eyebrows. The Egyptians had access to real narcotics. The opium poppy was known and traded in the ancient Near East, and many scholars believe opium reached Egypt by the New Kingdom era. Small jugs, shaped suspiciously like upside-down poppy heads, were imported by the thousands, and some researchers report traces of opium found inside them. The Ebers Papyrus contains a remedy that has launched 100 academic arguments. A prescription to calm a ceaselessly crying child using the seeds of a certain plant, which a number of historians read as poppy. If they're right, Egyptian parents were sedating screaming toddlers with diluted opium. Pediatricians today would faint. But it tells you something real. These people knew plants could switch pain off, and they used them. Alongside it, the blue lotus, Egypt's sacred flower, which appears in countless banquet scenes being sniffed and steeped in wine, and which contains mildly psychoactive sedative compounds. And cannabis appears in the medical papyri too, prescribed in several remedies. The Egyptian pharmacy was, let's say, better stocked than you'd expect. Shelf 4. The kitchen and the garden. Garlic and onions for strength and health, both genuinely anti-inflammatory. Pomegranate for intestinal worms. It really does contain compounds that paralyze them. Castor oil for the bowels, still in use within living memory. Coriander, juniper, frankincense, myrrh. Many with real, measurable antiseptic or anti-inflammatory effects. Was every remedy a winner? Absolutely not. The same papyri prescribe crocodile dung, mouse parts, and donkey hooves. Egyptian medicine was a mixture of sharp observation and pure folklore, and they had no way to tell which was which. But across centuries of trial and error, the things that worked kept getting copied onto the next papyrus. They were running a slow, crude, civilization-sized drug trial, and the survivors of it are still in your pharmacy. But pills and salves were only half the arsenal, because when the pain got truly bad, the Egyptians reached for the other weapon, magic. And before you smile at that, stay with me, because this is the part modern science has quietly come back around to. To an Egyptian, medicine and magic weren't rivals. They were a package deal. Serious pain was often blamed on hostile forces, a demon, a ghost, the anger of a god that had entered the body. So a physician and a magician were often the same man, and a prescription came with a spell. The remedy attacked the symptom, the incantation attacked the cause. We have entire collections of these spells, words to be recited over the wound, over the medicine, over the patient, commanding the pain to leave, calling on Isis, the great healer of the gods, who once cured the sun god himself. For a mother in labor, the most dangerous pain of an Egyptian woman's life, the household summoned protective gods. Bes, the fierce little dwarf who scared off evil, and Taweret, the pregnant hippo goddess. Women gave birth gripping amulets, surrounded by spells, sometimes on bricks carved with divine protectors. There was no epidural. There was a wall of words and gods between you and the fear. Now, did the spells do anything? Here's the uncomfortable, fascinating answer. Probably yes. Not because demons are real, but because pain isn't just a signal in the nerves. It's an experience built in the brain, and the brain is suggestible. Modern medicine calls it the placebo effect, and it is embarrassingly powerful. In study after study, belief that treatment is happening measurably reduces reported pain. Confidence, ritual, the voice of an authority figure telling you it will pass. These things genuinely dial pain down. An Egyptian priest in full regalia, burning incense, chanting that the demon is leaving your body while applying a willow and honey dressing? That's not the opposite of medicine. That's a placebo delivery system bolted onto real pharmacology. They were treating the body and the brain at the same time, something modern pain clinics now do on purpose. And then there were the moments beyond all remedies. Surgery. It happened, rarely, carefully, and awake. The Edwin Smith Papyrus walks through treating skull fractures, stitching wounds with needle and thread, setting broken bones with splints and bandages, and the archaeological record confirms it. We've found Egyptian skeletons with cleanly set, well-healed fractures and skulls bearing surgical openings with bone regrowth around the edges, meaning the patient survived the operation. The toolkit was bronze knives, drills, saws, and forceps. The anesthetic was, at best, enough wine and sedative plants to take the edge off. The rest was speed, skill, and people holding you down. If there is one image that captures the entire ancient relationship with pain, it's that one. A skilled surgeon working as fast as he possibly can on a patient who can feel everything, both of them simply enduring what could not yet be switched off. The skill was real. The courage, on both sides of the knife, is hard for us to even imagine. So pull it all together and look at what the Egyptians actually built. A trained medical profession with textbooks and honest diagnoses. A pharmacy where, mixed in with the dung and the donkey hooves, sat proto-aspirin, antiseptic honey, opiates, and working anti-inflammatories. A psychological arsenal of ritual and belief that genuinely blunted suffering. And the hard-won surgical knowledge to set bones and close wounds well enough that patients lived. With no germ theory, no anatomy worth the name, no idea why anything worked. They got there by 3,000 years of watching, recording, and refusing to accept that pain was just fate. And that might be the real legacy. Because every civilization before and around them mostly treated suffering as something sent by the gods, to be endured, appeased, accepted. The Egyptians wrote it down, organized it, and attacked it like an engineering problem. That stubborn idea that pain has causes, and causes have treatments, is the idea your entire medicine cabinet is built on. The next time a headache starts behind your eyes, and you reach for that little bottle, and the pain just stops. 20 minutes, gone, like flipping a switch. Remember what that switch cost. 3,000 years of toothaches that never ended, of bones that healed crooked, of mothers gripping amulets in the dark. of physicians copying out one more time the recipe with the willow leaves, not knowing why it helped, only that it did, and that someone after them might need it. Someone after them was you. The pain they couldn't escape built the relief you don't even think about. The least we can do is think about it, once, before we swallow the miracle and get on with our day.